Tell me about your experience in community nursing.
Throughout my nursing career, I have had the privilege of working extensively in community nursing, which has allowed me to develop a deep understanding of patient-centered care outside the traditional hospital setting. My experience spans several years, during which I have worked closely with diverse populations, including elderly patients, individuals with chronic illnesses, and families in underserved communities. I have been actively involved in health promotion, disease prevention, and providing holistic care tailored to the unique needs of each patient. One of the key aspects of my role has been conducting home visits to assess patients' health conditions, monitor their progress, and provide education on managing their health effectively. This has included administering medications, wound care, and supporting patients with mobility issues. I have also collaborated with multidisciplinary teams, including social workers, physiotherapists, and dietitians, to ensure comprehensive care plans are in place. Additionally, I have organized and participated in community health initiatives, such as vaccination drives, health screenings, and workshops on topics like diabetes management and maternal health. These experiences have honed my ability to communicate effectively with patients and their families, build trust, and empower them to take an active role in their health. Working in community nursing has taught me the importance of adaptability, cultural sensitivity, and resourcefulness, as I often encounter varying living conditions and health literacy levels. It has been incredibly rewarding to make a tangible difference in the lives of individuals and contribute to the overall well-being of the community.
What specific populations have you worked with in a community setting?
Throughout my career in community nursing, I have had the opportunity to work with a wide range of populations, each presenting unique challenges and learning experiences. One of the primary groups I have worked with includes elderly patients, particularly those managing chronic conditions such as diabetes, hypertension, and mobility issues. My role involved providing in-home care, conducting regular health assessments, and educating patients and their families on effective disease management and fall prevention strategies. I have also worked extensively with pediatric populations, particularly in underserved communities, where I focused on immunization programs, growth monitoring, and parental education on nutrition and developmental milestones. This experience allowed me to develop strong communication skills to engage with both children and their caregivers effectively. Additionally, I have supported individuals with mental health conditions, including those dealing with depression, anxiety, and substance abuse. In these cases, my role extended beyond physical care to providing emotional support, connecting patients with community resources, and collaborating with mental health professionals to ensure a holistic approach to their well-being. Another significant population I have worked with includes individuals from culturally diverse backgrounds, including refugees and immigrants. This required a high level of cultural sensitivity and adaptability to address language barriers, differing health beliefs, and unique social determinants of health. I often worked with interpreters and community leaders to bridge gaps and ensure equitable access to care. These experiences have not only enriched my clinical skills but also deepened my understanding of the social, economic, and cultural factors that influence health outcomes. They have reinforced my commitment to providing compassionate, patient-centered care to all individuals, regardless of their background or circumstances.
Describe your experience with home visits and patient assessments in the community.
My experience with home visits and patient assessments in the community has been both challenging and deeply rewarding. Over the years, I have conducted numerous home visits, which have allowed me to provide personalized care in the comfort of patients' own environments. These visits typically begin with a thorough assessment of the patient's physical, emotional, and social well-being. I evaluate vital signs, monitor chronic conditions, assess wound healing, and review medication adherence, ensuring that each patient's care plan is tailored to their specific needs. One of the most valuable aspects of home visits is the ability to observe patients in their daily living conditions. This provides insights into potential risk factors, such as unsafe home environments or lack of social support, which might not be evident in a clinical setting. For example, I have identified fall hazards in elderly patients' homes and worked with families to implement safety modifications, significantly reducing the risk of injuries. During these visits, I also prioritize patient and family education. I take the time to explain medical conditions, demonstrate proper care techniques, and provide guidance on lifestyle modifications to improve health outcomes. For instance, I have educated patients with diabetes on blood sugar monitoring, dietary adjustments, and foot care to prevent complications. In addition to physical assessments, I place a strong emphasis on building trust and rapport with patients and their families. This is particularly important in community nursing, as many patients may feel isolated or hesitant to seek care. By fostering open communication and showing genuine empathy, I have been able to address their concerns effectively and encourage proactive health management. Collaboration is another key component of my home visit experience. I frequently liaise with other healthcare professionals, such as physiotherapists, social workers, and dietitians, to ensure a comprehensive approach to patient care. This teamwork has been instrumental in addressing complex cases and improving overall patient outcomes. Overall, my experience with home visits has reinforced the importance of adaptability, patience, and a holistic approach to nursing. It has been incredibly fulfilling to witness the positive impact of personalized care on patients' lives and to contribute to their long-term well-being.
How familiar are you with local community resources and support services?
I have developed a strong familiarity with local community resources and support services throughout my experience in community nursing. Understanding and utilizing these resources is a critical aspect of providing holistic care, as it ensures that patients have access to the support they need beyond clinical interventions. Over the years, I have built a network of connections with various organizations, including social services, mental health support groups, food banks, and rehabilitation centers, which has enabled me to refer patients to appropriate services tailored to their unique circumstances. For example, I have frequently collaborated with local food assistance programs to help patients facing food insecurity, particularly those managing chronic conditions like diabetes or hypertension, where proper nutrition is essential. I have also worked closely with transportation services to ensure that patients with mobility challenges can attend medical appointments or access community health programs. In cases involving mental health concerns, I have connected patients with counseling services, support groups, and crisis intervention programs. This has been especially important for individuals dealing with anxiety, depression, or substance abuse, as it provides them with ongoing support and reduces the risk of isolation. Additionally, I have utilized resources such as housing assistance programs for patients experiencing homelessness or unsafe living conditions, as well as financial aid services for those struggling to afford medications or medical equipment. For elderly patients, I have often referred them to senior centers, respite care services, and fall prevention programs to enhance their quality of life and independence. To stay updated on available resources, I regularly attend community health meetings, participate in local health fairs, and maintain communication with social workers and case managers. This proactive approach ensures that I can provide patients with the most current and relevant information. My familiarity with local resources has not only enhanced my ability to address the social determinants of health but has also empowered patients to take control of their well-being. It has been incredibly rewarding to see how connecting patients with the right support services can make a significant difference in their lives.
What certifications or training do you have that are relevant to community nursing?
I have pursued several certifications and training programs that have equipped me with the skills and knowledge necessary to excel in community nursing. One of the most significant certifications I hold is in public health nursing, which has provided me with a solid foundation in health promotion, disease prevention, and population health management. This certification has been instrumental in helping me understand the unique challenges and opportunities of working in community settings. Additionally, I am certified in Basic Life Support, BLS, and Advanced Cardiac Life Support, ACLS, which are essential for managing emergencies that may arise during home visits or community health initiatives. I have also completed specialized training in wound care management, which has been particularly valuable when caring for patients with chronic wounds or those recovering from surgeries at home. To further enhance my ability to support patients with chronic conditions, I have obtained a certification in diabetes education. This training has enabled me to provide comprehensive education on blood sugar monitoring, dietary management, and lifestyle modifications, empowering patients to manage their condition effectively. I have also completed courses in mental health first aid and crisis intervention, which have been invaluable when working with patients experiencing mental health challenges or substance abuse issues. These trainings have equipped me with the skills to provide immediate support, de-escalate crises, and connect patients with appropriate mental health resources. Furthermore, I have participated in cultural competency training to better serve diverse populations, including refugees, immigrants, and individuals from various socioeconomic backgrounds. This training has deepened my understanding of cultural influences on health behaviors and improved my ability to provide culturally sensitive care. Lastly, I regularly attend workshops and seminars on community health topics, such as health equity, social determinants of health, and community resource utilization. These ongoing educational efforts ensure that I stay current with best practices and emerging trends in community nursing. Overall, these certifications and training programs have not only enhanced my clinical skills but also prepared me to address the multifaceted needs of patients in community settings, ensuring that I can deliver high-quality, patient-centered care.
How do you stay up to date with current community health practices and guidelines?
Staying up to date with current community health practices and guidelines is a priority for me, as it ensures that I can provide the highest standard of care to my patients. One of the primary ways I stay informed is by regularly attending professional development workshops, seminars, and conferences focused on community health. These events not only provide insights into the latest evidence-based practices but also offer opportunities to network with other healthcare professionals and share knowledge. I am also an active member of several professional nursing organizations, such as the Community Health Nurses Association and the Public Health Nursing section of the American Nurses Association. These memberships give me access to valuable resources, including journals, newsletters, and webinars, which keep me informed about emerging trends, research findings, and updates to clinical guidelines. In addition, I subscribe to reputable medical and nursing journals, such as the Journal of Community Health Nursing and American Journal of Public Health, to stay current with the latest research and best practices. I often review case studies and clinical guidelines published by organizations like the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, which provide evidence-based recommendations for community health interventions. Collaboration with colleagues is another important aspect of staying updated. I regularly participate in multidisciplinary team meetings and case discussions, where we review recent developments in community health and share insights from our own experiences. This collaborative approach helps me integrate new knowledge into my practice. Lastly, I take advantage of online courses and certifications to deepen my expertise in specific areas of community health, such as health equity, chronic disease management, and mental health support. Platforms like Coursera and professional nursing associations offer courses that are both convenient and comprehensive. By combining these strategies, I ensure that my practice remains aligned with the latest standards and that I am well equipped to address the evolving needs of the communities I serve.
How do you assess the needs of individuals and families in their homes?
Assessing the needs of individuals and families in their homes requires a holistic and patient-centered approach, which I have refined through my experience in community nursing. When conducting a home visit, I begin by building rapport and establishing trust with the patient and their family. This involves active listening, showing empathy, and creating a comfortable environment where they feel safe to share their concerns and challenges. The assessment process itself is comprehensive and multidimensional. I start by evaluating the patient's physical health, including vital signs, symptoms, and any existing medical conditions. I review their medical history, current medications, and adherence to treatment plans, as well as their nutritional status, mobility, and ability to perform activities of daily living. For patients with chronic conditions, such as diabetes or heart disease, I assess their understanding of their condition and their ability to manage it effectively. Beyond physical health, I also assess the emotional and psychological well-being of the patient and their family. This includes identifying signs of stress, anxiety, depression, or other mental health concerns that may impact their overall health. I pay close attention to the family dynamics and the level of support available to the patient, as this can significantly influence their ability to manage their health. Another critical aspect of the assessment is evaluating the home environment for safety and accessibility. I look for potential hazards, such as fall risks, poor lighting, or cluttered walkways, and provide recommendations for modifications to improve safety. I also assess the availability of essential resources, such as food, transportation, and medical supplies, and identify any gaps that may need to be addressed. To ensure a thorough understanding of the patient's needs, I engage in open-ended conversations with both the patient and their family members. I ask about their goals, challenges, and any barriers they face in accessing care or maintaining their health. This collaborative approach helps me develop a care plan that is tailored to their unique circumstances and priorities. Finally, I document my findings meticulously and use them to create a personalized care plan in collaboration with the patient, their family, and other healthcare professionals. This plan often includes health education, referrals to community resources, and follow-up visits to monitor progress and adjust interventions as needed. By taking this comprehensive and empathetic approach, I ensure that the needs of individuals and families are fully understood and addressed, empowering them to achieve better health outcomes.
Describe your experience with wound care, medication management, and other common home-based nursing procedures.
My experience with wound care, medication management, and other home-based nursing procedures has been extensive and has allowed me to develop a high level of proficiency in these critical areas. In wound care, I have managed a variety of wounds, including surgical incisions, pressure ulcers, diabetic foot ulcers, and traumatic injuries. My approach begins with a thorough assessment of the wound, including its size, depth, and stage of healing, as well as any signs of infection or complications. I am skilled in cleaning and dressing wounds using aseptic techniques to prevent infection and promote healing. I also educate patients and their families on proper wound care practices, such as changing dressings, monitoring for signs of infection, and maintaining a clean environment. For patients with chronic wounds, I collaborate with wound care specialists to develop and implement advanced treatment plans, such as negative pressure wound therapy or specialized dressings. In terms of medication management, I have extensive experience ensuring that patients adhere to their prescribed medication regimens. This includes reviewing medications with patients to confirm they understand the purpose, dosage, and potential side effects of each drug. I also assess their ability to self-administer medications, particularly for those with cognitive or physical limitations, and provide tools such as pill organizers or reminders to support adherence. For patients requiring injectable medications, such as insulin or anticoagulants, I provide hands-on training to both patients and their caregivers. Additionally, I monitor for any adverse effects or interactions and communicate with prescribing physicians to make necessary adjustments. Beyond wound care and medication management, I am experienced in performing a range of other home-based nursing procedures. These include catheter care, where I ensure proper insertion, maintenance, and hygiene to prevent urinary tract infections, enteral feeding, where I manage feeding tubes and educate families on nutrition and hygiene, and vital sign monitoring, which is crucial for patients with chronic conditions or those recovering from acute illnesses. I also assist with mobility and rehabilitation exercises, particularly for elderly patients or those recovering from surgery, to help them regain independence and prevent complications such as muscle atrophy or blood clots. Throughout these procedures, I prioritize patient comfort, safety, and education, ensuring that they and their families feel confident in managing their care at home. My ability to adapt to the unique challenges of home-based care, such as limited resources or varying living conditions, has been key to delivering effective and compassionate nursing services.
How do you handle a patient who is non-compliant with their treatment plan?
Handling a patient who is non-compliant with their treatment plan requires a compassionate, patient-centered approach that focuses on understanding the underlying reasons for their non-compliance and addressing them effectively. When I encounter a non-compliant patient, my first step is to engage in open and non-judgmental communication to build trust and rapport. I ask open-ended questions to explore their perspective, such as, "Can you tell me more about any challenges you're facing with your treatment?" Or, "Is there something about the plan that doesn't work for you?" This helps me identify potential barriers, whether they are physical, emotional, cultural, or logistical. Once I understand the root cause of the non-compliance, I work collaboratively with the patient to develop a more realistic and tailored plan that aligns with their lifestyle, preferences, and capabilities. For example, if a patient finds it difficult to take multiple medications throughout the day, I might suggest simplifying the regimen or using tools like pill organizers or reminder apps. If cost is a barrier, I explore alternative medications or connect them with financial assistance programs. Education is another critical component of addressing non-compliance. I take the time to explain the importance of the treatment plan in a way that is clear and relatable, emphasizing how it will benefit their health and quality of life. I also provide practical tips and demonstrations, such as showing a patient how to administer an injection or explaining the long-term consequences of uncontrolled diabetes, to help them understand the value of adherence. In cases where emotional or psychological factors, such as depression or denial, contribute to non-compliance, I approach the situation with empathy and may involve mental health professionals or support groups to provide additional resources. I also involve family members or caregivers when appropriate, as their support can play a significant role in encouraging adherence. Finally, I maintain regular follow-ups to monitor progress, address any ongoing challenges, and celebrate small successes to motivate the patient. By fostering a supportive and non-judgmental relationship, I aim to empower patients to take an active role in their care and overcome barriers to compliance.
What strategies do you use to promote patient education and self-management?
Promoting patient education and self-management is a cornerstone of my approach to nursing, as it empowers patients to take an active role in their health and improves long-term outcomes. One of the key strategies I use is tailoring education to the individual needs, preferences, and literacy levels of each patient. I begin by assessing their current understanding of their condition and treatment plan, as well as any cultural or language barriers that may affect their ability to absorb information. This allows me to deliver education in a way that is clear, relatable, and accessible. I use a variety of teaching methods to ensure that the information resonates with the patient. For example, I often incorporate visual aids, such as diagrams, charts, or videos, to explain complex concepts like how diabetes affects the body or how to properly use an inhaler. For hands-on skills, such as wound care or administering injections, I provide step-by-step demonstrations and then guide the patient or caregiver through the process until they feel confident. I also use teach-back techniques, where I ask the patient to explain or demonstrate what they've learned, to confirm their understanding and address any gaps. Another important strategy is breaking down information into manageable, actionable steps. Instead of overwhelming patients with too much information at once, I focus on small, achievable goals, such as monitoring blood sugar levels daily or incorporating a short walk into their routine. I provide written materials, such as brochures or checklists, that they can refer to at home, and I encourage them to keep a journal or log to track their progress. To support self-management, I emphasize the importance of setting realistic goals and celebrating small successes. For example, if a patient with hypertension reduces their salt intake or starts exercising regularly, I acknowledge their efforts and reinforce the positive impact on their health. I also encourage patients to identify potential challenges and brainstorm solutions with me, which helps them feel more in control and prepared to overcome obstacles. Additionally, I leverage technology to enhance patient education and self-management. This includes recommending reliable health apps for medication reminders, symptom tracking, or fitness goals, as well as providing access to online resources or virtual support groups. For patients who prefer in-person support, I connect them with community programs, such as diabetes education classes or smoking cessation workshops. Finally, I maintain ongoing communication and follow-up to reinforce learning and address any new concerns. Whether through regular home visits, phone calls, or telehealth check-ins, I ensure that patients feel supported and motivated to continue managing their health effectively. By combining these strategies, I aim to equip patients with the knowledge, skills, and confidence they need to take charge of their well-being.
How do you ensure patient safety during home visits?
Ensuring patient safety during home visits is a top priority for me, and I take a proactive and thorough approach to minimize risks and create a secure environment for both the patient and myself. Before each visit, I begin by reviewing the patient's medical history, current condition, and any specific safety concerns, such as fall risks or infection control needs. This preparation helps me anticipate potential challenges and plan accordingly. When I arrive at the patient's home, I start by assessing the environment for safety hazards. This includes checking for clutter, poor lighting, loose rugs, or uneven surfaces that could increase the risk of falls, particularly for elderly or mobility-impaired patients. I also ensure that medical equipment, such as oxygen tanks or wound care supplies, is stored and used correctly to prevent accidents. If I identify any risks, I discuss them with the patient and their family and provide recommendations for modifications, such as installing grab bars or removing tripping hazards. Infection control is another critical aspect of patient safety. I adhere to strict hygiene practices, such as hand washing before and after each interaction, using personal protective equipment, PPE, when necessary, and properly disposing of medical waste. I also educate patients and their families on infection prevention measures, such as proper wound care techniques or the importance of cleaning shared surfaces. During the visit, I closely monitor the patient's condition and respond promptly to any signs of distress or deterioration. For example, if a patient with heart failure experiences sudden shortness of breath, I assess their vital signs, provide immediate interventions as needed, and contact their healthcare provider for further guidance. I always carry a well-stocked emergency kit with essential supplies, such as a blood pressure cuff, glucometer, and first aid materials, to address urgent situations. Communication is also key to ensuring safety. I maintain open and clear communication with the patient and their family, explaining each step of the care process and addressing any concerns they may have. I also document my observations and interventions meticulously, ensuring that other healthcare providers are informed of the patient's status and any changes in their condition. Finally, I prioritize my own safety by following organizational protocols, such as scheduling visits during daylight hours when possible, informing colleagues of my itinerary, and using a mobile phone or communication device to stay connected. By taking these comprehensive measures, I create a safe and supportive environment that promotes the well-being of both the patient and myself.
How do you manage infection control in a home setting?
Managing infection control in a home setting requires a combination of strict adherence to protocols, patient education, and environmental awareness. My approach begins with thorough hand hygiene, which is the cornerstone of infection prevention. I wash my hands with soap and water or use an alcohol-based hand sanitizer before and after every patient interaction, as well as after handling any equipment or materials. I also educate patients and their families on the importance of hand hygiene and demonstrate proper techniques to ensure they can follow these practices effectively. When providing care that involves exposure to bodily fluids, such as wound care or catheter management, I use appropriate personal protective equipment, PPE, including gloves, masks, and gowns, to minimize the risk of contamination. I ensure that all used PPE is disposed of properly in designated waste containers and that reusable equipment, such as scissors or thermometers, is cleaned and disinfected according to established guidelines. I pay close attention to the cleanliness of the patient's environment, as homes can harbor germs that pose infection risks. I assess the living space for potential hazards, such as dirty surfaces or improperly stored medical supplies, and provide guidance on maintaining a clean and safe environment. For example, I recommend regular cleaning of high-touch surfaces, such as doorknobs, light switches, and countertops, using appropriate disinfectants. I also advise patients on proper laundry practices for items like bedding and towels, especially if they have open wounds or infections. For patients with contagious conditions, such as respiratory infections or MRSA, I implement additional precautions to prevent the spread of infection. This may include isolating the patient within the home, using dedicated equipment, and ensuring that caregivers follow strict hygiene practices. I also educate the patient and their family on recognizing signs of infection, such as fever, redness, or swelling, and emphasize the importance of seeking prompt medical attention if these symptoms arise. Proper disposal of medical waste is another critical aspect of infection control. I ensure that items like used dressings, needles, and gloves are disposed of in puncture-resistant, leak-proof containers and that these containers are stored securely away from children or pets. I also provide guidance on how to obtain and use sharps containers if the patient requires regular injections or blood glucose monitoring. Finally, I stay informed about current infection control guidelines and best practices through ongoing education and training. This allows me to adapt my approach as needed and ensure that I am providing the highest standard of care. By combining these strategies, I effectively manage infection control in home settings, safeguarding both the patient and their family from preventable infections.
How do you build rapport with patients and families from diverse backgrounds?
Building rapport with patients and families from diverse backgrounds is essential to providing effective and compassionate care, and I approach this with cultural sensitivity, empathy, and active listening. I begin by acknowledging and respecting the unique cultural, linguistic, and social factors that shape each individual's perspective on health and healthcare. I take the time to learn about their background, values, and preferences, which helps me tailor my communication and care to their specific needs. One of the key strategies I use is active listening. I give patients and their families my full attention, allowing them to express their concerns, beliefs, and expectations without interruption. I ask open-ended questions to better understand their experiences and show genuine interest in their stories. For example, I might ask, "Can you tell me more about how your family typically approaches health and wellness?" Or, "What are your thoughts on the treatment plan we've discussed?" This not only helps me gather important information but also demonstrates that I value their input and respect their autonomy. Language barriers can sometimes pose a challenge, but I address this by using professional interpreters or translation services when necessary. I also learn basic phrases in the languages commonly spoken by the communities I serve, which helps bridge gaps and build trust. Nonverbal communication, such as maintaining eye contact, using a warm tone of voice, and displaying open body language, also plays a significant role in fostering connection. I make a conscious effort to be culturally sensitive and avoid making assumptions based on stereotypes. For instance, I recognize that dietary preferences, family dynamics, and health beliefs can vary widely across cultures, and I incorporate this understanding into my care plans. If a patient prefers traditional remedies alongside conventional treatments, I work collaboratively with them to find a balanced approach that respects their beliefs while ensuring safety and efficacy. Building trust also involves being transparent and consistent in my actions. I explain medical information in a clear and accessible way, using visual aids or simplified language when needed, and I follow through on any promises or commitments I make. I also involve family members in discussions and decision-making when appropriate, as their support can be crucial to the patient's well-being. Finally, I demonstrate empathy and compassion by acknowledging the challenges patients and their families may face, whether they are related to health, finances, or social determinants. I strive to create a safe and non-judgmental space where they feel comfortable sharing their concerns and asking questions. By taking these steps, I build strong, trusting relationships that empower patients and families to actively participate in their care and achieve better health outcomes.
Describe a time you had to communicate sensitive information to a patient or family.
One instance that stands out occurred when I was caring for an elderly patient with advanced stage cancer. The family had been hopeful that the treatment plan would lead to recovery, but after a series of tests, it became clear that the patient's condition was deteriorating, and palliative care was the most appropriate option. Delivering this news required sensitivity, empathy, and clear communication. I began by scheduling a private meeting with the patient and their immediate family to ensure they had a safe and comfortable space to process the information. I started the conversation by acknowledging their hopes and efforts, saying something like, "I know how much you've all been hoping for improvement, and I want to thank you for the incredible care and support you've provided." This helped establish a compassionate tone and showed that I respected their emotional journey. Next, I explained the medical findings in a clear and straightforward manner, avoiding overly technical language. I used visual aids, such as diagrams of test results, to help them understand the situation. I made sure to pause frequently, allowing time for questions and ensuring they were following along. I also validated their emotions, saying, "This is difficult news to hear, and it's okay to feel upset or overwhelmed." Throughout the conversation, I emphasized that the goal was to ensure the patient's comfort and quality of life. I discussed the options for palliative care, including pain management and emotional support, and reassured them that the care team would be there to guide them every step of the way. I also connected them with additional resources, such as a social worker and a grief counselor, to provide ongoing support. After the meeting, I followed up with the family individually to address any lingering questions or concerns. I also made myself available for further discussions, recognizing that processing such information often takes time. By approaching the situation with empathy, honesty, and a focus on their needs, I was able to help the family navigate this challenging transition with dignity and support.
How do you collaborate with other healthcare professionals and community organizations?
Collaboration with other healthcare professionals and community organizations is a vital aspect of providing comprehensive and holistic care, and I approach it with a focus on teamwork, communication, and shared goals. In my experience, effective collaboration begins with establishing clear lines of communication and mutual respect among all parties involved. For example, when caring for a patient with complex needs, I regularly coordinate with physicians, social workers, physical therapists, and dietitians to ensure that everyone is aligned on the care plan and working toward the same objectives. I actively participate in multidisciplinary team meetings, where we discuss patient progress, share insights, and adjust care plans as needed. During these meetings, I contribute my observations and expertise as a nurse, while also valuing the perspectives of other professionals. This collaborative approach ensures that the patient receives well-rounded care that addresses their physical, emotional, and social needs. When working with community organizations, I take the time to understand the services they offer and how they can benefit my patients. For instance, I have partnered with local food banks to address food insecurity, connected patients with transportation services to ensure they can attend medical appointments, and referred individuals to mental health support groups or addiction recovery programs. I maintain open communication with these organizations, providing them with relevant information about the patient's needs while respecting confidentiality and privacy. I also use technology to facilitate collaboration, such as electronic health records, EHRs, to share updates with other healthcare providers or telehealth platforms to consult with specialists. This ensures that everyone involved in the patient's care has access to the most current information and can make informed decisions. Additionally, I advocate for my patients by acting as a liaison between them and other professionals or organizations. For example, if a patient is struggling to navigate the healthcare system or access resources, I step in to help bridge the gap, whether by arranging appointments, completing paperwork, or explaining processes in a way that is easy to understand. Ultimately, my goal is to create a seamless network of support around the patient, leveraging the expertise and resources of various professionals and organizations to achieve the best possible outcomes. By fostering strong partnerships and maintaining open communication, I ensure that my patients receive the comprehensive care they deserve.
How do you handle challenging or difficult conversations with patients or families?
Handling challenging or difficult conversations with patients or families requires empathy, patience, and strong communication skills. My approach is to create a safe and supportive environment where they feel heard and respected. I begin by preparing for the conversation, ensuring I have all the necessary information and a clear understanding of the situation. This helps me present the facts accurately and confidently. When initiating the conversation, I choose a private and comfortable setting to ensure confidentiality and minimize distractions. I start by acknowledging the difficulty of the situation and expressing empathy. For example, I might say, "I understand this is a tough topic to discuss, and I want you to know that I'm here to support you." This sets a compassionate tone and helps build trust. I communicate the information clearly and honestly, using simple, non-technical language to ensure understanding. I avoid overwhelming the patient or family with too much information at once and instead break it down into manageable parts. I also pause frequently to allow time for questions and to gauge their emotional state. For instance, I might say, "I've shared a lot of information. How are you feeling about what we've discussed so far?" Active listening is a crucial part of these conversations. I give them my full attention, validate their emotions, and acknowledge their concerns. If they express anger, fear, or sadness, I respond with empathy and reassurance, saying things like, "It's completely normal to feel this way," or "We'll work through this together." I also involve them in decision-making as much as possible, presenting options and discussing the pros and cons of each. This empowers them to take an active role in their care and helps them feel more in control. For example, if discussing end-of-life care, I might say, "Here are the options we can consider. What feels most aligned with your values and wishes?" After the conversation, I provide written materials or resources to reinforce the information and ensure they have something to refer back to. I also follow up with them to address any additional questions or concerns and to offer ongoing support. By approaching difficult conversations with empathy, clarity, and a focus on collaboration, I aim to help patients and families navigate challenging situations with dignity and confidence.
How do you document patient care and communicate findings to the healthcare team?
Documenting patient care and communicating findings to the healthcare team are critical aspects of ensuring continuity and quality of care. My approach to documentation is thorough, accurate, and timely, as I understand that these records serve as a vital resource for the entire care team. I use electronic health records, EHRs, whenever possible, as they allow for efficient and secure sharing of information. When documenting patient care, I focus on capturing all relevant details, including the patient's current condition, interventions performed, responses to treatment, and any changes in their status. I use clear, concise language and adhere to standardized formats to ensure consistency and readability. For example, I follow the SOAP, subjective, objective, assessment, plan, format to organize my notes, which helps provide a comprehensive overview of the patient's situation. I also include any patient or family concerns, education provided, and follow-up plans to ensure that nothing is overlooked. In addition to routine documentation, I prioritize real-time communication with the healthcare team, especially when there are significant changes in the patient's condition or when urgent action is needed. For instance, if a patient's blood sugar levels are consistently unstable, I document the findings in the EHR and immediately notify the physician or diabetes educator to discuss adjustments to the care plan. I use secure messaging systems or phone calls for time-sensitive updates, ensuring that the team is informed promptly. For ongoing collaboration, I participate in regular team meetings or case conferences where we review patient progress and coordinate care. During these discussions, I present my observations and insights clearly, focusing on key points that require attention or action. I also actively listen to input from other team members, as this helps us develop a cohesive and effective care plan. When communicating with the team, I emphasize the importance of a patient-centered approach, ensuring that the patient's preferences and goals are always considered. For example, if a patient expresses a desire to prioritize comfort over aggressive treatment, I make sure this is clearly documented and communicated to all relevant providers. Finally, I ensure that any handoffs or transitions of care, such as shift changes or transfers to another facility, include detailed and accurate documentation. I use tools like SBR, situation, background, assessment, recommendation, to provide a structured and efficient summary of the patient's status and needs. By maintaining meticulous documentation and fostering open communication with the healthcare team, I contribute to a seamless and coordinated approach to patient care, ultimately improving outcomes and ensuring the patient's needs are met.
What is your understanding of the social determinants of health?
My understanding of the social determinants of health is that they are the non-medical factors that significantly influence an individual's health outcomes and overall well-being. These determinants include a wide range of social, economic, and environmental conditions, such as income, education, housing, access to healthcare, employment, social support networks, and neighborhood safety. They play a critical role in shaping health disparities and inequities, often affecting vulnerable populations more profoundly. For example, a patient living in a low-income neighborhood may face challenges such as limited access to nutritious food, unsafe living conditions, or inadequate transportation to medical appointments. These factors can contribute to poorer health outcomes, such as higher rates of chronic diseases or delayed treatment for acute conditions. Similarly, a lack of education or health literacy can hinder a patient's ability to understand and manage their health effectively. In my practice, I recognize the importance of addressing these determinants to provide holistic and equitable care. I take the time to assess the social and environmental context of each patient's life, asking questions about their living situation, financial stability, and support systems. This helps me identify barriers to care and develop strategies to mitigate their impact. For instance, if a patient cannot afford their medications, I connect them with prescription assistance programs or explore alternative treatment options. I also collaborate with community organizations and social services to address broader social determinants. For example, I have referred patients to food banks, housing assistance programs, and job training services to help improve their overall quality of life. Additionally, I advocate for policies and initiatives that address systemic issues, such as improving access to affordable housing or expanding public transportation in underserved areas. Understanding and addressing the social determinants of health is essential for reducing health disparities and promoting health equity. By taking a comprehensive approach that considers both medical and non-medical factors, I aim to provide care that not only treats illness but also empowers patients to achieve long-term well-being.
How do you advocate for the health needs of vulnerable populations?
Advocating for the health needs of vulnerable populations is a fundamental part of my role as a nurse, and I approach it with a combination of compassion, education, and action. I begin by building trust and rapport with individuals from these populations, ensuring they feel heard and respected. This involves active listening, showing empathy, and addressing any cultural or language barriers that may hinder communication. One of the key ways I advocate is by identifying and addressing the social determinants of health that disproportionately affect vulnerable groups, such as poverty, lack of access to healthcare, food insecurity, and unsafe living conditions. For example, if I encounter a patient who cannot afford their medications, I connect them with prescription assistance programs or work with their healthcare provider to find more affordable alternatives. If a patient faces transportation barriers, I help them access community resources or telehealth options to ensure they can receive care. Education is another critical component of my advocacy efforts. I empower patients by providing them with the knowledge and tools they need to manage their health effectively. This includes explaining their conditions and treatment plans in a way that is easy to understand, as well as teaching them how to navigate the healthcare system. For instance, I might help a patient with limited health literacy understand the importance of regular screenings or assist them in completing paperwork for social services. I also collaborate with community organizations, policymakers, and healthcare teams to address systemic issues that impact vulnerable populations. For example, I have participated in initiatives to expand access to mental health services in underserved areas and advocated for policies that improve housing stability and food security. By working at both the individual and systemic levels, I aim to create lasting change that benefits entire communities. Additionally, I use my voice to raise awareness about the challenges faced by vulnerable populations. This includes participating in public health campaigns, writing articles, or speaking at community events to highlight the need for equitable healthcare access and resources. Ultimately, my goal is to ensure that vulnerable populations receive the care and support they deserve. By combining direct patient advocacy with broader community and policy efforts, I strive to reduce health disparities and promote health equity for all.
Describe your experience with public health initiatives or community outreach programs.
In my nursing career, I have been actively involved in public health initiatives and community outreach programs, recognizing their critical role in disease prevention and health promotion. One of the most impactful experiences I had was participating in a vaccination drive aimed at increasing immunization rates among underserved populations. I worked closely with a multidisciplinary team to educate families about vaccine safety, address their concerns, and administer immunizations efficiently. Additionally, I contributed to a community-based health education program focused on chronic disease management, particularly for diabetes and hypertension. I helped organize workshops, provided one-on-one counseling, and guided patients on lifestyle modifications to improve their health outcomes. Seeing individuals gain confidence in managing their conditions reinforced my belief in the power of preventative care and education. Beyond direct patient care, I have collaborated with local health agencies to conduct screenings and promote early detection of illnesses. By engaging with the community, building trust, and providing accessible healthcare information, I have seen firsthand how these initiatives lead to better long-term health outcomes. My experience in public health has strengthened my ability to advocate for patients beyond the hospital setting, ensuring they receive the resources and knowledge needed to lead healthier lives.
How do you promote health education and disease prevention in the community?
Promoting health education and disease prevention in the community is a fundamental aspect of my nursing practice. I believe that empowering individuals with knowledge leads to healthier choices and improved long-term outcomes. One of the ways I achieve this is through direct patient education, ensuring that individuals understand their conditions, treatment plans, and preventive measures. Whether in a clinical setting or a community outreach program, I take the time to explain health information in simple, practical terms tailored to different literacy levels. Beyond individual education, I have actively participated in community health programs, organizing seminars and workshops on topics such as proper nutrition, exercise, chronic disease management, and the importance of vaccinations. I also engage in public health campaigns by collaborating with local health agencies and schools to spread awareness about key health issues. In addition, I recognize the power of technology and social platforms in reaching a broader audience. I have contributed to online health education initiatives, sharing evidence-based information in an accessible manner. By combining face-to-face engagement with digital outreach, I ensure that health promotion efforts are inclusive and effective. My approach is always patient-centered, focusing on culturally sensitive and practical strategies that encourage people to take proactive steps in maintaining their health. By building trust and fostering open communication, I help bridge the gap between medical knowledge and everyday life, ultimately supporting healthier communities.
What is your understanding of health disparities, and how do you address them in your practice?
Health disparities refer to differences in health outcomes and access to healthcare that exist among various populations due to factors such as socioeconomic status, race, ethnicity, geographic location, and education level. These disparities often result in higher rates of chronic diseases, reduced life expectancy, and poorer overall health in marginalized communities. As a nurse, I recognize that addressing health disparities is not just about treating illness but also about understanding the social determinants of health that contribute to these inequities. In my practice, I take a patient-centered approach to bridge these gaps. I ensure that my care is culturally competent, meaning I respect and incorporate patients' beliefs, values, and language preferences when providing treatment and education. I also advocate for patients by connecting them with resources such as financial assistance programs, transportation services, and community health organizations that can help them access the care they need. Additionally, I actively participate in public health initiatives that target at-risk populations, such as free health screenings, vaccination drives, and chronic disease management programs. Through these efforts, I help make healthcare more accessible and equitable for those who might otherwise face barriers to receiving care. Ultimately, I believe that reducing health disparities requires both individual commitment and systemic change. By listening to patients, addressing their unique challenges, and working with interdisciplinary teams to promote health equity, I strive to ensure that every patient receives quality care, regardless of their background or circumstances.
What are your thoughts on community-based preventative care?
Community-based preventative care is essential to reducing the burden of disease and promoting long-term health. Rather than focusing solely on treating illnesses after they develop, preventative care emphasizes early intervention, education, and health promotion within the community. I strongly believe that by addressing health concerns at the community level, we can improve overall well-being, reduce hospital admissions, and lessen the strain on healthcare systems. In my experience, preventative care is most effective when it is accessible and tailored to the needs of specific populations. For example, organizing free screenings for conditions like diabetes, hypertension, and cancer can lead to early detection and better management of these diseases. Similarly, vaccination programs, maternal health initiatives, and nutritional education campaigns play a critical role in preventing illness before it starts. As a nurse, I actively engage in preventative care by educating patients on healthy lifestyle choices, proper medication adherence, and disease prevention strategies. I also collaborate with local organizations to bring healthcare services directly to underserved populations, ensuring that barriers like cost, transportation, and lack of awareness do not prevent individuals from receiving the care they need. Ultimately, I believe that preventative care is not just a medical responsibility, it is a community effort. By working together with healthcare professionals, educators, and local leaders, we can empower individuals to take charge of their health and create a culture of wellness that benefits everyone.
Describe a time you had to handle a crisis situation during a home visit.
During a home visit to a patient with uncontrolled diabetes, I encountered a critical situation that required immediate action. The patient, an elderly man living alone, was experiencing severe hypoglycemia. He was confused, sweating profusely, and had difficulty speaking, clear signs that his blood sugar levels had dropped dangerously low. Recognizing the urgency of the situation, my task was to stabilize his condition while ensuring his safety. I quickly assessed his vital signs and confirmed hypoglycemia using his glucometer. I immediately administered a fast-acting glucose source, fruit juice available in his home, and monitored his response closely. As his condition improved, I guided him through consuming a more sustained carbohydrate source to prevent another drop in blood sugar. Once he was stable, I took further action to prevent future episodes. I contacted his primary care provider to report the incident and adjust his care plan. I also educated the patient on recognizing early signs of hypoglycemia, the importance of regular meals, and proper medication management. Additionally, I coordinated with a family member to ensure he had support at home and access to necessary supplies. As a result of these interventions, the patient avoided hospitalization and gained a better understanding of managing his diabetes safely. His family became more involved in his care, and follow-up visits showed significant improvement in his blood sugar control. This experience reinforced my ability to stay calm under pressure, make quick clinical decisions, and prioritize patient education in crisis situations.
Tell me about a time you had to work with a patient who had limited resources.
During my time as a home health nurse, I cared for a patient with congestive heart failure who was struggling to manage his condition due to limited financial resources. He lived alone, had difficulty affording medications, and lacked transportation to attend follow-up appointments. His condition was worsening because he was unable to adhere to his prescribed treatment plan. Understanding the severity of the situation, my task was to find practical solutions to help him receive the care he needed while working within his limitations. First, I assessed his immediate health needs, ensuring he had enough medication for the short term. I then took action by connecting him with a local medication assistance program that helped cover the cost of his prescriptions. I also arranged for a community-based transportation service so he could attend his follow-ups with his cardiologist. Additionally, I provided him with practical, low-cost strategies for managing his condition, such as dietary modifications using affordable food options and simple home exercises to reduce fluid retention. I also coordinated with a social worker to explore long-term support services, including home-delivered meals and financial assistance programs. As a result, the patient was able to continue his treatment without financial strain, and his health gradually stabilized. He became more engaged in his care, attending his appointments regularly and following his modified lifestyle plan. This experience reinforced my belief in the importance of advocacy and resourcefulness in nursing, ensuring that every patient receives quality care, regardless of their financial situation.
Give an example of a time you had to advocate for a patient's needs.
During my time working in a hospital, I cared for an elderly patient with limited mobility who was scheduled for discharge. However, I noticed that he lived alone and lacked the necessary support system to manage his recovery safely. He had difficulty walking, no family nearby, and limited financial resources to afford home healthcare services. Recognizing the risks, my task was to advocate for a safer discharge plan that would prevent complications or hospital readmission. I immediately communicated my concerns to the attending physician and discharge planning team, emphasizing the patient's mobility limitations and lack of support at home. I also collaborated with the hospital's social worker to explore alternative care options. I took further action by securing a temporary stay at a rehabilitation facility where he could receive physical therapy and assistance with daily activities. Additionally, I helped him apply for home health services through a community program, ensuring he would continue to receive medical care and support once he transitioned back home. As a result, the patient regained his strength and independence through rehabilitation, significantly reducing his risk of falls and complications. He was later discharged with a structured care plan, including follow-up visits and in-home assistance. This experience reinforced my commitment to patient advocacy, ensuring that vulnerable individuals receive the care and resources they need to recover safely and maintain their well-being.
Describe a situation where you had to adapt your care plan to meet the unique needs of a patient.
During my time as a home health nurse, I cared for a patient with advanced Parkinson's disease who was experiencing difficulty with medication adherence. His tremors and muscle rigidity made it nearly impossible for him to open pill bottles or manage small tablets, leading to missed doses and worsening symptoms. Recognizing the challenge, my task was to adapt his care plan in a way that made medication management easier while ensuring he remained independent. After assessing his specific limitations, I took action by coordinating with his physician and pharmacist to transition him to liquid formulations and larger, easy-to-handle pill options whenever possible. I also introduced a medication management system using a pre-filled pill organizer with a simple, flip-top design that he could open with minimal effort. Additionally, I involved his family by educating them on strategies to support him without taking away his autonomy. We arranged for a voice-activated reminder system so he wouldn't forget doses, and I worked with an occupational therapist to explore assistive tools that could improve his daily function. As a result, the patient was able to manage his medications more effectively, leading to better symptom control and an improved quality of life. This experience reinforced the importance of individualized care, showing me that even small adjustments can make a significant impact on a patient's health and independence.
How would you handle a situation where you suspect a patient is being abused or neglected?
If I suspected a patient was being abused or neglected, my priority would be to ensure their safety while following the proper protocols for reporting and intervention. In one instance, while conducting a home visit for an elderly patient with dementia, I noticed signs that raised concerns. He appeared malnourished, had poor hygiene, and had unexplained bruises on his arms. His caregiver, a family member, seemed evasive when I asked about his condition, and the patient appeared withdrawn and anxious. Understanding the seriousness of the situation, my task was to assess the patient's well-being while handling the matter with sensitivity and professionalism. I carefully documented my observations, including his physical condition, emotional state, and any inconsistencies in the caregiver's explanations. I engaged the patient in conversation to gauge his responses while ensuring he felt safe and heard. Next, I took action by following my organization's mandated reporting procedures. I reported my concerns to the appropriate authorities, such as Adult Protective Services, and informed my supervising nurse and social worker. Additionally, I coordinated with the healthcare team to arrange a more thorough assessment, including a medical evaluation to document any signs of mistreatment. As a result, the patient was placed under closer supervision, and protective measures were implemented to ensure his safety. The investigation led to additional support services being provided, improving his living conditions and overall well-being. This experience reinforced my responsibility as a nurse to advocate for vulnerable patients and take immediate action when abuse or neglect is suspected. Ensuring patient safety goes beyond medical care. It requires vigilance, ethical responsibility, and the courage to intervene when necessary.